Hey everyone, this is Dr. Nicole. I am here with you today. Ironically, I am talking about viruses as I am fighting my own virus. So we are actually talking about viruses, which is piggybacking off of the video that we did, which was part of our six-part series. So we are to the second to last video. Wait, there he is. He's sitting right behind me. That's Pappy. He'll be joining us. He doesn't usually leave me alone. But we did our six-part series. So today we're actually doing a Q&A on the viruses video. So for those of you who have not watched it, just take a look in the comments area because we will have the link to the video posted. If you have not watched it, that is okay. Definitely feel free to listen in because we will be going through some pre-submitted questions on viruses, and I will be going into a little bit of a summary about the video in general. And then you can obviously have the opportunity to watch the video afterwards. So like I said, ironically, I am fighting my own virus. For those of you who didn't see it already, we actually posted an Instagram story with one of our really amazing technologies that we have at IWG that was able to actually tell me what I am fighting, and it is not the flu. So many people are like, you have the flu, and I was like, I don't have the flu. So it turns out it's something called adenovirus. And interesting enough, there's all different types of viruses. They're all different ways that they affect us. They're all different ways that they manifest within the body. And with that being said, we go a lot more in depth in the video that we did. But today, again, we want to go through some of these questions that were pre-submitted. But to give you a quick summary on viruses, and the reason why they're important is because most of the time when we are dealing with some type of illness, it's always assumed that it's bacterial, and usually the solution is some level of antibiotics. And for those of you that don't know, antibiotics are strictly going to work on bacteria. They will not create any improvements in anything viral. So sometimes when you feel better, taking an antibiotic, but you truly have a virus, it's simply placebo effect, meaning, it's the idea of knowing that you're supposed to get better from the antibiotic, which is allowing you to get better. And it really shows you how powerful the brain can be. They prove this over and over again when they do clinical trials, when they're studying different types of medications and even supplements. So with that being said, when you have a virus, it's really important to get some level of testing to really figure out, is it viral, is it bacterial, because you don't necessarily want to go on antibiotics if it's not necessary, especially if you don't have a bacterial issue. So with that being said, viruses are interesting because they actually don't leave the body. They have a tendency to affect our DNA. So because of that reason, once they get into the system, they are in the system, and it's either they're going to be active or dormant. So many of us can have these dormant viruses that are in our systems long term, and then all of a sudden we have, this period of time in our life that all of a sudden we feel like things are kind of falling apart, and we feel like our bodies are shutting down on ourselves, and we're just kind of like, what's going on? I don't understand what's happening in my body, and why was this so abrupt? And the most common thing that I see with women especially is this type of thing happens after a pretty significant hormonal change. So if that means it's after a child, if it's after a miscarriage, if it's after even menopause, that they feel like their body takes this really, really big dip. And at that point, because of this hormonal shift, is when viruses can actually rear their ugly heads and become active. This is very, very typical of the Epstein-Barr virus. Some of you may have heard of that virus because Epstein-Barr is the virus that causes mono. And with some of the technologies that we have at IWG, we very, very often find mono hanging out in people's lymph nodes. And a lot of times people are like, I never had mono. And I was like, well, you did, you just didn't know, because at the time, whenever you were exposed, it just didn't hit you very hard, which is great. But now, later in life, it's rearing its ugly head, and now you're experiencing chronic fatigue. So that's really important to know, is that Epstein-Barr virus in particular is really known for fatigue, including chronic fatigue syndrome. And that's one of the reasons why when you hear about, people in their teens that get mono, they usually are homeschooled because they're so fatigued that they're sleeping most of the day. They can't really function very well. So on top of that, going back to the fatigue, is really stuck and congested, gunked up lymph nodes is another source of chronic fatigue. So if we have this conglomeration of this virus that's also stuck in our lymph nodes, which is allowing our lymph nodes to not be moving through the body effectively, this is going to be a double whammy for fatigue. And with that being said, lymph nodes are something that's so overlooked when we're doing, it doesn't matter if we're doing medicine or if we're doing even functional medicine or anything alternative, because lymph nodes are something that needs to be addressed more through therapies of the dog, more so than supplementation or even dietary changes. So when I work with my patients, I kind of explain to them that over time, your lymph nodes are going to become congested just because your lymph nodes are in charge of clearing out toxins, heavy metals, pesticides, viruses, etc. So if your lymph moves through your body naturally like a river, it starts to become more like sludge over periods of time. And it's because it's holding so many different organisms within it. And the way to really get that moving and working more optimally is using things that heat you. So when people tell me that they don't sweat, that's usually a huge red flag for me, because that means that their lymph is so congested that now they're not even sweating, because one of the body's natural ways of detoxing the lymph is actually sweating. So one of the therapies that we recommend for people in our office is infrared sauna, because it actually heats your body from the inside out in order to burn off some of the things that are gunking up your lymph nodes and even other tissues of the body. Some of the great things that you could do even at home is dry brushing. You can actually purchase a dry brush online and read up on how to do it. But pretty much you're using the dry brush to mobilize the lymph and move it closer to the torso, because your lymph gets filtered through your lungs and your heart. The other really great thing that you could do at home is something called rebounding, which is jumping on a trampoline. Even if you do, and it's a small trampoline, so you could fit it in your house. But this is something that you could do 10 minutes a day, and it's super, super effective at getting your lymph working more optimally. So these are just some simple tools that you can utilize to get your lymph working so that these viruses don't have the opportunity to become active later in life and start to cause problems. So to get into some of the questions, can viral infections stay dormant in your system forever? So this kind of piggybacks off of what we were talking about. And yes, they can. As long as you have a really healthy immune system and your filters are working. And what I mean by that is your lymph nodes are healthy, they're working, you're sweating, you're doing some level of exercise to induce sweating. You also have a healthy liver and gallbladder and spleen, which are all huge as filtration systems of the body. If all of those things are working optimally, then you could easily have viruses in your system that will never cause problems. But unfortunately, in the day and age that we live in, we're all kind of going to deal with some level of exposures that affect those filters and gunk them up. So chances are we will deal with some level of active viruses at some point. And it's usually the kick in the butt to start taking better care of ourselves. So another question, are we born with viruses? And I thought this was a very valuable question, because in some of my other talks that I've done in this 6-part series, I've talked about different things that can be passed from mom to baby. And viruses are not excluded from that. And because viruses store within the body and they manifest in our DNA, we obviously are we're a creation from our parents' genetics. So for that reason, we will have exposure to the viruses that our parents have had exposure to. And that's partly because of our genetic makeup. And then also if there were viruses in the birth canal, like things like HPV, and we were a natural birth that went through the birth canal, we can have exposure in that way. The dogs, they're just like hounding me. So if you see my arm moving, you know why. He's like, pet me, please. So another question that I have is, do viral cells mutate? And this is also a very interesting question too. So going back to this conversation about viruses affecting DNA, so most of viruses, they're actually either DNA based or they're RNA based. So this, again, these are just very specific, like genetic type terms. And because of this reason, RNA viruses specifically, I'll give you a few examples. Polio, rotavirus, yellow fever, hepatitis C, I have to use my cheat sheet, rabies, flu, as well as even measles. These are actually all classified as RNA viruses. So RNA viruses are kind of interesting because they don't always bind properly when you're getting into more of the nitty-gritty of the genetics. So to keep it very, very simple, they go through this binding process, and sometimes when things don't bind properly, there's an inborn mechanism that will fix it and fix the error. And RNA viruses don't have that capability. So if the error isn't fixed, it actually makes the virus a lot more able to mutate. So because of this reason, that's why some of those conditions that I listed, those viruses like polio, yellow fever, rabies, and even flu, they have a tendency to morph into other types of viruses. So like as an example, you might get a flu shot and think you're protected, but the flu that's going around can easily morph and mutate into a similar but slightly different version of that flu. So you get the shot, think you're protected, but then you end up getting the flu. And it's because it's a very hard virus to control because it can mutate so easily. So this is just something to take into consideration when you are considering, I have to get this vaccine in order to protect me, and especially when it comes to a flu shot, because it is something that can mutate, very quickly, and it can mutate within the same season. So we could be easily having, hundreds, even thousands of different types of flu strains just this winter season. So definitely some valuable information to take into consideration. Another question was, are all viruses antibiotic resistant? And I mentioned this a little bit earlier on, that antibiotics are strictly for bacterial infections. They are not for viral infections. So when you're dealing with a viral infection and you get recommended an antibiotic, it's not going to do anything to the virus. It's not the nature of how it works. Fortunately, there are a lot of amazing antivirals that exist that are natural. So some of the examples that I use in my office is, one of them is actually called humic acid. One of my favorite products is actually a combination of humic acid and monolaurin. Those obviously can be taken separately, but the product is called humic monolaurin. So that is an amazing antiviral. And also L-lysine. Many people are aware of L-lysine nowadays because they use it as a natural alternative to control their herpes viruses. So people that get cold sores, they'll use L-lysine when they're having a flare in order to control that. So the monolaurin, humic acid, and L-lysine are some really, really good examples that can be used in order to control viral infections. Another one too, you have to be careful with it, because St. John's wort does have some contraindications for how to use it. St. John's wort is another herb that's very commonly used for depression, but it actually is amazing at working on envelope viruses. So herpes viruses are an example there. So that is another alternative, but definitely if you are on any level of medications, you always have to check any contraindications with any of these herbs, because herbs are actually extremely powerful. They're very undermined, when it comes to medicine, because medicine is supposed to be, the most powerful of all, but most medicines are actually derived from herbs anyway. So a lot of the different supplements out on the market, depending on the brands that you're getting, can be just as powerful and sometimes more powerful than medication. So just know that there are alternatives out there when it comes to fighting viruses. Okay, so one of my last questions here is how to get tested for viral infections and can they be tested in the same way? So I think this is a really good question to end with, and the reason being is anytime you're dealing with lab testing, it's tricky. And the reason why I say that is because, blood work is only giving you a part of the puzzle. And there are many things that can get confusing, especially in the viral world when you're dealing with blood work. And the reason why I say this is because most of these viruses are ebbing and flowing. They're either dormant or active, and this can change sometimes week by week if it's dormant or active. It really depends on so many external factors. It depends on your stress levels. It depends on, if you haven't been sleeping. It depends on your immune system. It depends on so many things. So you can easily get your blood drawn and it will tell you the viruses that are in your system, but it will appear that they are past infections and that they are not active at this time. So easily they can be passed off as non-problematic. So we will run these markers in the blood, but then secondarily, we will use other testing in office, one of the modalities being our bioresonance scan, and then the other modality being the autonomic response testing, which was a type of testing that was originally created by Dr. Klinghardt. And we use both of these modalities to really see if the immune system is having a current reaction to these viruses, because that allows us to know, is this actually active and causing problems and stressing the body, even despite the blood work telling me that it is a past infection. So we always use various avenues to make sure that we are not giving the wrong diagnosis, but also not missing anything. Because again, blood can change day by day. I've seen it. I've seen it happen. I've seen someone come up with Lyme's disease in a blood panel and had blood work done by another physician that they brought to me, and the Lyme's disease panel was negative. And that's just very alarming because it's just showing that you can have this very, very definitive diagnosis of something like Lyme's disease, but maybe you don't. It's really, you have to back it up with other testing, and you have to look at the body, and you have to look at it from a chemistry standpoint. You also have to look at it from a physics standpoint and look at, the tissues using different things like frequencies. And these are therapies that are used commonly in Europe, and they're just not commonly used here in the States. So some of the technologies that we have really bridges the gap between chemistry and physics, and we really pride ourselves on being able to get the most accurate diagnosis for that reason. So that is all of the questions that I have today. But obviously, if you have not watched the video, please check out the link that is in the comments. We do have the video live on YouTube, so you are able to watch it at any time. And also with that, we also have a package that we've just put together for people like me that are suffering with a virus, flu or no flu. And I wanted to give all of our listeners and all of our followers a good alternative if you are feeling sick and you maybe did the antibiotic route and you're not feeling better, that you can come into our office and be able to get a bioresonance scan, get something else called a bioscan, and get some muscle testing to see what supplements that your body needs right now to kick this. So, and also a sauna, an infrared sauna, because that's actually where I just came from, was letting myself stay in that sauna for at least an hour, which is doing wonders on my sinuses. So definitely check that out if you're someone who's really been suffering this season with getting sick, or you're just really nervous about getting the flu. Get on some preventative supplements. There's so much information out there now, and they're saying people are dying from the flu. Please don't buy into that. It's a big ploy to get the vaccine. So just don't be fearful, but you can be preventative. So just check out some of the things that lovely Karina is posting in the comments here if you are interested. So we have our last video coming up next week, and we will be doing a Q&A. It's actually going to be more so about the emotional connections and the neurological connections to not feeling well and chronic illness. So please tune in, and we will be doing our Q&A actually on Monday because I leave for London on Tuesday, which I'm very excited about. So tune in then, and thank you so much for joining me today. I appreciate it. The puppies say bye. There they are. So we'll see you next week, everyone. Bye.